Okay, well, welcome again. We have signing for us today Josie McDaniel Burkett, and for an opening prayer, Chaplain Charles Poole.
Henry Ford said, "Coming together is a beginning. Keeping together is progress. Working together is success." Paul, as he writes to the Colossians, he reminds them to clothe themselves with compassion and kindness, humility, gentleness, patience, and forgiveness. And then he concludes by saying, "Over all these virtues, put on love, which binds them all together in perfect unity." Let us pray. Holy Father, we come today and we ask that you might help us to treat each other with that perfect love that brings perfect unity. Father God, we continue to look for your guidance and direction for our state and our nation. Would you open our hearts? Would you heal our hearts? Father, we ask that you would give our leaders discernment and wisdom like you gave to Solomon. Father, we are all reminded that you are still in control as you have always been. Calm us now, Father. Heal us, Father. Eradicate this virus from the world. And let us be reminded that we are all created in your image, and help us to relate to each other accordingly. Father, we thank you now for how you are going to act and the opportunities that we will have. And we pray in your holy name. Amen.
Thank you. And again, welcome to the Emergency Management Division. We will have some information. We'll try to answer your questions. We'll start with Dr. Linda Bell of the Department of Health and Environmental Control. Doctor.
Thank you, Governor. Good afternoon. Today we announce 528 new cases of COVID-19 and 7 additional deaths. This brings the total number of cases in South Carolina to 15,759, and the total number of deaths to 575. And I have to say that today I am more concerned about COVID-19 in South Carolina than I have ever been before. For the past 2 weeks, we've seen some of our highest daily numbers since the pandemic began. And there have also been recent increases in our percent positive, which tells us that more people than we would hope for who are being tested are sick. This is why we need everyone's help in re-emphasizing how critical it is for every one of us every day to wear a mask in public and to stay physically distanced from one another. Those two precautions, masks and social distancing, are how we stop this virus. Yesterday, DHEC issued a joint statement with the South Carolina Hospital Association and the South Carolina Office of Rural Health, reiterating how vitally important it is for all South Carolinians to adhere to these disease prevention methods. So we're all eager to return to our normal lives, or what our new normal will be, but it will take us that much longer to get there if we don't stop the virus today. It doesn't take hard data to observe that many people across the state aren't social distancing and aren't avoiding group gatherings and aren't using masks in public. And we really need all South Carolinians to take these precautions every day, not just to protect ourselves, but to protect others who could become severely ill or who could even die if they're exposed. Our increased testing data has allowed us to better identify hotspots, and this has recently included Greenville County. Greenville County has seen some of the highest daily case counts for any county in the state for over a week and a half. And when we identify a hotspot like Greenville, we dig deep into the data and we use the confidential information provided to us in our epidemiologists' work to help identify risk factors that could contribute to the spread in these areas. For Greenville, we've determined that several cases are stemming from some households, meaning that family members are infecting each other not unexpectedly in their homes. And that's why it's important to follow the advice of healthcare professionals and to stay in isolation and quarantine if you're diagnosed or you're a contact. And this helps protect your family. But we've also determined that approximately 31% of recent cases in Greenville have been occurring in a large Latino population. And so we've immediately targeted our outreach to efforts in these communities, and this has included interviews on local radio stations, Latino radio stations, and the redistribution of our Spanish-translated educational information and resources in these areas. We continue to increase COVID-19 testing availability in Greenville, and with the thanks of local hospitals and healthcare providers in healthcare facilities in those areas, we continue to work with community partners to accomplish that. And while we work to identify hotspots of virus activity in the state and take extra steps to help stop the spread of the virus in these areas, I ask everyone who's listening to me now to ask yourself how you can possibly help to stop the spread of the virus, what you can personally do to protect yourselves and to protect your communities so that we can return to normal activities sooner rather than later. This will help us reduce the impact of the virus that we are all experiencing if we take these individual measures and ask ourselves if there's more that we could do to stop the spread of the virus. Your community might not be a hot spot today, but there should be no mistake that COVID-19 transmission is still high and widespread in South Carolina at this time, and it remains a threat to all of us. The preventive measures that we are encouraging are really the only things that we have right now to keep us safe in the absence of a vaccine. We know that what we've been asking everyone to do is not easy, but I can't stress enough that it's really absolutely necessary. And working together, we can turn the tide on COVID-19 and help save more lives in South Carolina. Thank you.
Just a number of things. First of all, just to echo what Dr. Bell said, this is it's a question of individual responsibility, and it's something that we all have at our disposal. When I was growing up, I remember when the Smokey Bear campaign was relatively new. Smokey Bear was a little bear that was found after a forest fire out west someplace, and he became the emblem of preventing forest fires, the symbol. And he was always saying, only you can prevent forest fires. Y'all probably remember that. Well, that appealed to children. What we're trying to do now is appeal to adults, children, and everybody in between, as Dr. Bell has said, and you've heard just about every day of over almost 3 months now, coming from this place and others, is that we all have to practice that social responsibility by not becoming infected and not infecting others. And whether it's by wearing masks, wearing shields, keeping the social distance, staying out of confined places, avoiding crowds, it's just a question of being respectful of your fellow citizens. And that is the only way that we will stop this virus, short of a vaccine. And the vaccine is not here yet. We don't know when it's going to be here. But it's disappointing to go to places and see people all jammed up in crowds, celebrating the beautiful weather, celebrating being in South Carolina, but at the same time exposing themselves and possibly others to these risks. And the ultimate price for this lack of care is death. And it's serious, and we've already had 575 people die from it. Now, I'm not saying that they were the cause of their demise. Perhaps it was somebody else, but you don't want it to be you. So we've got to be careful. And again, we have it, each of us has it at our disposal, in our power, to be careful. And so whatever happens, we cannot keep businesses closed forever. We can't isolate South Carolina from the rest of the world. What it boils down to is we must be careful individually. So we're asking, all of us that work on this every day are asking all of everyone else to take these requests, take this information to heart and be careful, because this virus is with us. It's not going to disappear. The cold weather, the hot weather is not going to kill it. It may be seasonal, it may not be, but it's on the face of the earth, and it's going to be here until a vaccine is created for it, and that is not here yet. So we have to be careful. Now, in South Carolina, we have taken some steps to see that South Carolina accelerates back into the economy. As you know, the economy in South Carolina was way up at the top in the country. The economies were booming all over the United States, and we were right at the top. Well, we want to get there again. The virus has certainly slowed us down, but we can't stop, and we can't remain shuttered or restricted much longer. So we are I'm asking the General Assembly, and we've had meetings with the leadership of the General Assembly on a number of these, and I'm presenting a report to them today from the Accelerate SC Committee. It's a tremendous report. As you remember, we had about 30 permanent members and then others that participated, including all the state agencies, to come up with plans to keep the people safe and healthy and also re-accelerate or revitalize the economy. In South Carolina, we didn't close hours down like they did in some other places, but we certainly slowed down. But it's time, even in this situation where we still are faced with a deadly virus, we must accelerate our economy. And don't just think of the businesses and the big buildings, think of the families, think of the people who are dependent on their jobs, think of the people taking their children to school, or will be taking them back to school in August and possibly some this summer. But just look at those people, look at the workers, look at the people you see in the stores, in the grocery stores, bank tellers, people working in the streets, all kinds of people in South Carolina, many in the tourism business or the service industry. Just think of those people, young and old. They need to work. They have to have money to pursue their life's plans, to feed their children, to pay the mortgage, to pay their bills, to keep the electricity on. So we have to get back to work. So the Accelerate SC has a variety of recommendations to the legislature, but probably the three that would be of the most interest at this time is that Unemployment Insurance Trust Fund. The Unemployment Insurance Trust Fund is money that is paid by businesses based on their payroll. So when their employees are laid off, they'll have a fund to go for I think it's 20 weeks. The maximum is about $326 a week. In this virus period, the federal authorities have added $600 to that. So it's a hefty amount going out, but our trust fund started off at $1.1 billion. Now, in 2008, 2009, it was just about drained with the unemployment back then, as you remember. The state borrowed money from the federal government, and just a couple of years ago, we ended up paying it back, and we were able to even reduce our taxes on the businesses. And when the virus struck in early March, we had $1.1 billion. Well, estimates are that by the time we get to December, we will be over $600 million short. So what we're asking the General Assembly to do is from that $1.9 billion to immediately when they arrive back this month for the first session is to provide at least $500 million into that trust fund. Of the $1.9 billion, at least $500 million. That will take us, if the best scenario, the most optimistic pictures for our economy hold true as predicted by the Department of Employment and Workforce and others, that will almost bring us back up to level. It's likely to be short. If the downturn, if the economy is worse than we thought, then that $500 million won't be nearly enough. But we're hoping for the best. We're hoping to go back to work, but we've got to have at least that $500 million to go in immediately, and we'd like to have more than that. We'll be working for that. I'm also recommending that $215 million from the fund, from the 1.9, be used to reimburse public school districts who provide additional days of classroom instruction before the scheduled start of the school year, or expand their hours during the school year or before the school year. What this will do is it will bring 5 days of early instruction or expanded hours to the children who have missed that because of the closure of the schools, and bring those children up to full speed so they'll be ready to enter school. And that is they'll be able to absorb, they learn. You miss things over the summer anyway, but with this virus closing down the schools early, although we had a terrific distant learning program going on, there were a lot of students still need help. So we're asking for $215 million for that. Also, we're asking for $225 million that be directed for the reimbursement of verified and legitimate COVID-19 related expenses incurred after March 1st for the state agencies, local governments, first responders, hospitals, institutions of higher education. That'll allow these government agencies to reconcile their books by the end of the fiscal year, and we'll be off to a good start. So those are our plans at the time. We've had conversations, we in the office have had conversations with the leadership in the House and the Senate, as well as the agencies. I want to thank again the members, those who participated in Accelerate SC. It's really a unique operation, a unique assembly of talent to find our way, the best way to re-accelerate the economy in South Carolina, which accelerates the happiness and strength of the people in South Carolina, and that is our goal. Not only to go back to where we were in our economic growth and strength, but even more as we move forward. With that, I'll be glad to answer questions. Yes, John?
So, obviously, you want people to wear masks. Would you entertain requiring people to wear masks?
No, ma'am. There are some limits to what we can do and what we can enforce. I want to say again, as you've heard from this podium many times, it is very important for people to wear masks, to wear those face shields. And if you are outside in a field by yourself, then it's not important. You don't need to do that there. But if you're in a room full of people, particularly the smaller the room, the more the people are in elevators. If any of you have gotten in elevators, you probably have a sensation that you're glad you have a mask on. We know that the virus, we've learned so much about it. We know that it is transmitted by coughing and sneezing, but also just the exhalation of air, singing. There was one example of a choir. I don't remember how many people were in the choir, but there was one lady on the back corner of the choir who had later tested positive. Well, I think just about the whole choir got the disease, later tested positive. That's just an anecdotal thing. I don't know where it was, but the point is, when you have people exhaling vigorously, as at perhaps sporting events, as at choirs, and you have other people, particularly if you're in an enclosed place, and they're singing and they are inhaling and exhaling, and that's a great recipe for spreading that virus. That's why we have to be so careful. But the answer is at this point, the answer is individual responsibility. It's not mandates by the government. I'm delighted to see that the Hospital Association and others are joining with DHEC to once again remind people. Everyone needs to remind their neighbors that this is a serious thing. And I guess there are some people all over the country that it's not really real for them until somebody they know dies of the virus. Well, by that time, it's too late to save that person. So we have to understand that we're in a serious situation, and it's up to every individual to see to it that they don't spread that virus. Yes, ma'am.
The current state of emergency, is that set to end tomorrow? Are you planning to?
We will extend it again for the obvious reasons.
Governor, I have a question.
Oh, well, that's a new state of it. It always changes every couple of weeks. Have a different situation. Dr. Bell mentioned some of the various communities. Certain communities seem to have an abundance of the virus way outside of their numbers. We know that the older people, I think it's a high percentage of those. I think about 87% of the people in our state who have died from the virus are over 60 or 65 years old. So we have to be careful about those communities. particularly the nursing homes, the extended care places, and also these particular communities. A lot of them are rural communities where we need to have ample testing and tracing, and that's what we intend to do. Yes, ma'am.
On the issue of masks, because you're not mandating it statewide, I mean, there have been a number of restaurants, I'm just thinking about in the Columbia area, that were open but then closed after an employee tested positive for COVID-19. For some of us who have gone to restaurants just to see what it's like, we've noticed employees at restaurants not wearing masks, not wearing gloves. Would you at least make it a requirement that employees at restaurants or businesses wear them?
The best enforcement of that is that restaurant, that place. We do not have enough police officers to go around the entire state and enforce mandates. They may walk in and everybody put a mask on, and when they walk out, they take them off. Again, it is up to the people to determine what kind of precautions need to be followed. And we all know those precautions. When the virus first arrived, there were a lot of things we didn't know about it. Well, we've gotten a lot of those questions answered. None of them are real good news. One is it's highly contagious, one that is transmitted very easily, one that is deadly, and also it's going to be with us. We're going to have to, we hope we find a vaccine. I know there are institutions and people, including the Trump administration, working hard to do that. But until that day comes, we just have to be careful. There's nothing else that we can do. Mandates, government intrusion, there's a limit to how much the government can do. There is a constitutional limit. For example, on closures. Closing a business is essentially the taking of that property for a short period of time. If that time is extended for too long, that business can't survive, and the government has taken that property. That's not allowed without compensation. It's a constitutional question. That's why what we've done has been carefully targeted, deliberately imposed only on those places that have the greatest threat of spreading the disease. And I think the figures are showing that in South Carolina we've done it very well. But we've got to come out of it. We cannot keep mandating things on the people. One, because the law doesn't allow it. Two, because it's unenforceable. And three, because that's not the best way to do it. Best way to do it is for everybody to understand it's up to them and to comply with the courtesies, the consideration and respect for others, including their own health and their families.
Because of the high number of cases that we've been seeing in the last few days, does that push back any potential announcement about opening the rest of the businesses that have yet to reopen?
No, ma'am. We always take those things into consideration, but we want to open things up as soon as we can, as carefully as we can. But what it does do is emphasize the need for people practicing social distancing, people being careful. That's the answer. It's not closing businesses. I've got no intention of closing any more businesses. No intention. What we need to do is practice that social distancing. Or practice, if you know another word for it, be smart. There's a lot of stupid floating around out there, here and there. There's a lot of reckless, careless activity. We ask everybody to be very careful. Yes, ma'am.
This is a question for Dr. Bell. Can you talk a little bit about the other hot spots that you all are seeing?
Doctor?
I'd actually refer you to our website because I don't have the data in front of me, but it should be sufficient to say that we are monitoring that. And for each hotspot, we conduct an investigation to see if we can identify root causes between social contacts, community activities that could have contributed to it. And so there are several in the state. Our county maps show that. And each of those from the individual level is being investigated for their contacts, but also a community assessment of what's going on in the community that can contribute largely to a hotspot. And so in some, we are identifying that there have been particular activities, like festivals or something like that, that a lot of people could have attended and weren't observing the recommendations.
While you're up there, you said several were found to be like home gatherings. Were those funerals? Were those parties, graduation parties, or what sort of gatherings?
No, so what I meant by home is that they are household contacts. So when we identify cases, and unexpectedly, the highest contact that you would have is the people that live in the household with you. So I was referring to clusters of cases. There are a number of individuals from the same household, not from a special event like a wedding or graduation or something like that.
Doctor, would you recommend closing anything down? We're seeing this percent positive start to increase again around the same time of these larger summer days and reopenings. In your expertise, would you recommend closing more things down?
Well, from our role in public health, it is to provide recommendations that prevent disease spread. And so, closures or reopenings is not our arena. What we do is inform people from our understanding of how the disease is spread, and we continue to learn more about this virus. We learn more that it is more transmissible than we expected, that it is more severe, there are more complications than we understood earlier. So our role is to inform about prevention measures, and at this time, the prevention measures that we know about for a respiratory virus are to contain respiratory droplets with masks and to prevent being close enough to someone that they could be contaminated with a respiratory virus.
And Governor, to you on a similar point, we're seeing again this correlation, this going up. You've said multiple times that you have no plans to, today, that you have no plans to close down anything else.
Yes.
And that you want people to self-regulate. You've been calling this for a couple months now, and yet we're still seeing this new increase. What else can be done if you're insistent on not closing things down again?
Very little. If closing down were the answer, then the cases would be disappearing in Minnesota and New York and all those places where they've closed down in other parts of the country, and there's still a lot of the businesses or industries are still closed down. But the cases are way more prevalent than they are in South Carolina. So that's not the answer. The answer we shuttered, we closed down some businesses. As you know, we didn't do the broad strokes like they did in other places. We didn't think that was smart. So we selected those that we thought were the incubators of the virus, places where there's close contact, big crowds, and those sorts of things. And as we've gone along now, after we have done that and we've learned about the virus, in the beginning of March, we knew not much about the virus. We know about it now, and we know how to keep it from spreading, and we know who is most vulnerable to it. So to keep an economy locked down, as they are still doing in some other states, is certainly not the answer. And the numbers that are produced there show that. The thing to do is we have to let people work. People have to be able to go and work for a living, to support their families, support their children, to pay their bills, to keep the lights on, to save for college and all those thousands of things. You simply cannot stop that indefinitely. We slowed it down in South Carolina enough to arm ourselves with the knowledge of what we need to do to be safe. Now what I'm saying is, as we have said from the beginning, is we now need to practice what we have learned.
But if shutting down before, because we saw that decrease earlier when we did shut down businesses and took those measures, wouldn't it work again?
The virus, the more we test, the more we find where the places were closed or open, the more we test, the more you find positive cases. And that's what's happening here. We're testing a lot more than we were at the beginning. At the beginning, remember, we didn't have the facilities, didn't have the capacity to do testing. That's why we were limiting it only to those who were showing certain signs of the virus. Well, those days are gone. Now everybody's getting tested. But again, if closing all the businesses were the answer, then the places that have done that would be doing great, but they're not. That's not the answer. And you cannot close, when you're closing a business, what you're doing is taking someone's livelihood from them. What they've learned, what they've studied for, what they like to do. People like to go to work, they want to go to work, they want to move up. And when the government closes down a business, you're taking that away from those people. Yes, ma'am.
Question for Dr. Bell. Is there any kind of correlation between the high number of cases that we're seeing and Memorial Day weekend tourism travel? We also have July 4th coming up, which is a very busy, heavy tourist and being outside kind of day. Is there any concern about the numbers spiking after July 4th as well?
Yeah, there is that concern about large community gatherings, and I think that the data reflects that. We began to see the first increasing trends several days after the Memorial Day weekend, which would explain, you go through an incubation period, and within several days, people may experience illnesses, and then from the time that it takes the test results to come back. So that would partly explain that, and it's not unexpected that we saw lots of activity with large gatherings, no social distancing, very rare use of masks, and so these findings are not unexpected.
Have you seen a spike since the protest?
Well, what we're seeing is a sort of slightly ongoing upward trend, and so there are lots of activities going on now. There are not only the protests, but there are behaviors in lots of communities where people do not appear to be paying attention to, in all sorts of gatherings, paying attention to social distancing. And it's not just one or the other. It's not just a mask or 6 feet. It should be a mask and 6 feet. So, we ask people to keep that in mind. There are many ways that people can participate in gatherings more safely than is happening now, but it should be both the mask and attempt to keep a distance from other people.
Doctor, there have been a decline in test numbers the last couple of days. Why is that? And do you have an ideal number you'd like to see in terms of daily testing?
Well, we're continuing to work towards the goal of testing 2% of our population every month. We did achieve that goal. We actually exceeded the goal and made it ahead of time. So that is the goal, to continue to do that every month. And we see some sporadic changes with the availability of testing reagents for certain planned testing sites. That hasn't been a significant problem recently as it was in the past, so we really do have sufficient capacity, particularly on our public health lab, to provide testing, and so that I think some sporadic occurrences perhaps of supplies not being available temporarily may contribute to that.
And I believe DHEC has revised its revisions. Is that because you aren't seeing people practice the guidelines?
Revised which?
What you're expecting in terms of caseload going forward?
That we've revised our revisions?
Your predictions, sorry.
Oh, revised our predictions? So we base our predictions on trends that we're currently seeing. So if the trends change, then our predictions of what we might see in the future in terms of hospitalizations, deaths, and illness in the community are adjusted accordingly.
Yes, ma'am.
With the responsibility being on restaurants and individuals, does the state have enough supply of PPE right now for these small businesses in order
Yes.
to have? Is there a number that we're trying to get to as
There's
well?
a huge number. We were looking at some of those numbers this morning. I think the number of gloves that have come into the state, I think it's something like 120 million. I mean, it's some fantastic number. We can get those numbers for you. But at the beginning, the demand was so great that it was difficult to get a lot of those personal protective equipment. But other manufacturers have switched over to this now, and we have a machine out at Fort Jackson at McCready Center that can actually process masks and clean them up, and they're as good as new, and it's available right now. And manufacturers have stepped in. Some have changed right here in Columbia, have changed over from one thing to another. So we ought to have plenty of that equipment. That's why it's just a shame that people aren't utilizing it. Before it was hard to get masks and things, but now it's not.
Are they having difficulty getting in contact with the right people to get those supplies?
No, ma'am. They can still they can call the county DHEC, or they can go online here. There's information. They can call the Emergency Management Division. Kim Stinson is there. Would you like to address those numbers? Yeah. Did I get it right?
Pretty close, yes, sir. We've got, they're kind of hard to remember, obviously. But in the last, since really the 1st of March of this year to I guess about the 5th of June, to the governor's point, in direct commercial distribution to points here in South Carolina for gloves, it was 188 million gloves. Some of the other numbers, 562,000 for N95 masks, over 5 million surgical masks, and then over 2 million gowns. And then that's the direct commercial distribution, but through our system, as the governor said, through emergency management and working with the local authorities, we've sourced over 1.4 million masks, over 1 million N95 masks, over 1 million surgical masks, over 4 million gloves, and over 500,000 gowns. So the supply chain is vastly improved, as the governor said, from when we first started. He asked me today where we started with PPE, and I told him 0. That's where we started originally in emergency management, and now we've gone a long ways in the last 2 months. But the key point here is that I think, as the governor said, that the supply chain and routine medical distribution and all that is working.
How about stockpile?
Right. One of the things that we're working on right now is to create some sort of stockpile for future events, and we've already ordered quite a bit of that. But we're just some numbers there for 30 days or 28 days, actually, 4 weeks. Over 400,000 N95 masks and over 1.8 million surgical masks, and we feel that that's just examples of some numbers that will hold us for at least 28 days or 4 weeks. At the federal level, they are going to replenish the strategic national stockpile. I don't know exactly what their numbers are, but I know today they were talking about on the N95 masks as many as 300 million in that national stockpile. So it's also being done at the local level as well, and I think also many of the hospitals are looking into establishing their own stockpiles. So we're working very hard collectively to ensure that we don't run into the same problem that we did here a couple of months ago.
Yes, ma'am?
More questions for Dr. Bell, if you don't mind.
Dr. Bell?
Yes. Both numbers questions. We've seen the percent positive over 10% the last few days. If you can kind of explain why that is, and then also, while the number of cases has risen, the number of deaths has stayed kind of about the same. We haven't seen a huge spike there. Can you also explain why DHEC, or why you think that is?
Well, the proportion of positives, the percent positive of testing, is when that goes up, that's an indicator that we are detecting more sick people in the population. So it is it's one indicator of adequacy of sampling in a population. So if you see a pretty low percent positive, which we had seen for a while, that gave us pretty good confidence that we were adequately sampling and catching a lot of people who weren't sick. When the percent positive goes up of the total number tested, then that tells you that we're looking at more people in the population who are sick, and also perhaps we need to expand testing so that we get that number to go down as an indicator of adequacy of testing. So as far as the number of cases going up and hospitalizations staying relatively stable, then it does tell us that there are more people in the community who are being tested who have milder illness. So in the past, people may not have sought medical care, had milder symptoms and didn't seek care. And I think there's also more awareness of the fact that there can be asymptomatic positives. So there are more people who are seeking testing who have no symptoms at all. And so that's a partial explanation for why we would see cases go up and not necessarily hospitalizations.
Speaking of the World Health Organization, they sent out some very confusing messaging earlier this week regarding asymptomatic cases and whether they transmit the disease. What do you say to that seemingly despondent message?
So I haven't seen the message from the World Health Organization specifically, but there is evidence that transmission occurs from people who are asymptomatic. And for this reason, we actually extended the time period that we consider contacts. We initially said that you're a contact if you've had close face-to-face contact with someone from the time of onset of symptoms while they were still symptomatic. And now we consider a contact as someone who's had close contact with someone in the 2 days prior to the onset of symptoms, because we recognize that some people who do not have symptoms can spread the virus.
Can you follow follow up though on the number of deaths, why we haven't seen a huge spike in
Could you
those
speak
numbers?
up a little?
Why we haven't seen a spike in deaths? I mean, they've stayed pretty much about the same the last few days. We haven't seen a crazy hike in those.
Well, when we look at data from one day to the next, it makes for a lot of reasons for variability. It's really better to follow a trend, to follow, what we're accumulating over time to better explain, so that it takes time to investigate cases and to capture the cause of death. And so from one day to the next, it's really difficult to comment on, what we're seeing. We need to follow the trends.
Is there a magic number that could be reached where either you would recommend a shutdown or partial shutdown, or governor that you would come and say, okay, we need to step things back? Is there a number of cases that we could see that would cause you to kind of backtrack a little bit just to make sure everybody's safe?
I'll say again that if shutting down were the answer, then these other states that have shut down and have been shut down would be showing zero spread. Shutting down is not the answer. When we shut down, we are shutting down people's livelihoods. And we just, under the United States Constitution, you simply cannot do that for an extended period of time, because that's taking their property from them. And these statistics, shutting a business, think of the business, it's not just the building and what they do in it, say a restaurant, but it's all the people that work there. You've got cooks, you've got cashiers, you've got the waiters and waitresses, you have the owners of the business, you have and you have the customers coming in the business as well. I mean, when you take someone's livelihood from them, you've taken a very big thing from them. So shutting down is not the answer. Being smart about it, which is what I think we have done, is the way to do it, and I think we're doing it the right way now. And I can refer you to some numbers. That this is positive cases per 100,000 per state. So how many people have tested positive out of 100,000 per state? Now these are very interesting numbers. In South Carolina, we're 209. I'll leave off the decimal. 293 per 100,000. North Carolina is 350. Georgia is 496. Now, North Carolina and Georgia are both bigger than we are, but that doesn't count in this. This is per 100,000 people. Again, we're at 293. North Carolina is 350. Georgia is 496. Alabama is 436. Mississippi is 594. Tennessee is 399. Virginia is 599. Florida is 300. Again, South Carolina is 293. Now, in our estimation, that's way too high. We want it to be much lower than that. But I think this shows that we've made some smart decisions that are working. Now, if you go and look at, I think it's Montana and North Dakota and Alaska, they're lower than this. West Virginia is lower than this. But then you go to Illinois, Michigan, Minnesota, New York, Pennsylvania, Connecticut, those places, and they're just sky high. And the sky high, of course, have all been locked down just about completely.
Question.
In the back, yes, ma'am.
I also want to bring up elections, which was also affected by the coronavirus. There were a lot of issues here in Richland County. Any plans moving forward with elections or with the Richland County Election Committee?
The Richland County Election Commission is the purview of the Richland County delegation to be sure that that is functioning properly. The State Election Commission, based on events, there are some places that have big crowds. They are going to see that in the runoffs, and there are some of those that we do have plenty of people. My understanding from the conversations and communications is that everyone thought that all of the polling places was adequate. All of them, some were combined, as you know, were adequately staffed. It turned out that they were not. And that's one of the things that we've learned. However, we also know that all of those votes are going to be counted, and that as far as we know, we have had a reliable election day.
On the issue of voting, I know it's up to the legislature, and they did not expand absentee voting for November, but would you recommend, just given the sheer number of people that we saw turn out yesterday, to expand absentee?
Not at this time, no, ma'am.
Last question.
On the
So-
question of expanding businesses, you mentioned
Expanding what?
reopening businesses. You mentioned that there's no reason that shutting down isn't the answer. However, some businesses in South Carolina are still shut down. Bowling alleys, just to name one. Are you considering opening these bowling
Yes, we
alleys?
are. We still, those that, of the, as you know, we took a deliberate, targeted approach in those that we restricted, limited, or shut down, and we're going out the same way that we went in. Those that you've mentioned involved concerts and theaters and also bowling alleys. We are reviewing the information. We have the recommendations of Accelerate SC. We hope to be able to make some good decisions very soon.
So
Shauna?
last year, you, on the Richland County issue, you fired the entire board. Obviously, we had lots of problems last night or yesterday. Would you consider again taking any sort of drastic step to?
Well, I'll do whatever is necessary to be sure that when the people go to the polls, they know that they're not going to have an unpleasant experience and that their votes will all be counted. The time you referred to before was not in the middle of a pandemic. This is a little bit different. There are different approaches, perhaps different recommendations of things that need to be done. But I'm confident that the State Election Commission is gathering information to see what we need to do, and they've already determined that we will have more people available for these runoffs, so we don't have the bottlenecks that we had yesterday. Y'all, thank you for coming.